Hello, good day and welcome again. Welcome to Children's Clinic. Children's Clinic, in case you're just joining us and you don't know what the program is all about, is a health magazine program that takes care of everything about the child. And so today on the program, we're taking a look at a topic that will be of interest to every parent, not mother, every parent and every stakeholder. We're talking about the child. Today we're taking a look at neonatal jaundice. What is neonatal jaundice, and how do you recognize neonatal jaundice? What are the telltale signs as mothers, as parents, as wards, as a child's carer? And then how do you recognize this is jaundice? This is neonatal jaundice. We'll take a look at some of this. And this today on the show, I have somebody who is a round peg who's going to talk about this. I have Dr. Oyenusi Elizabeth, who is a lecturer, College of Medicine, University of Lagos. She's also a consultant pediatrician, Lagos University Teaching Hospital. Thank you for joining us, Dr. Oyenusi.
Thank you for having me.
Like I said, we're taking a look at neonatal jaundice. What is neonatal jaundice?
Okay, neonatal jaundice means jaundice in the neonatal period, and neonatal period is the first 1 month of life. And jaundice means yellowish discoloration of the sclera, and the sclera is the white parts of the eyes. And also the jaundice, this discoloration can also be seen on the skin, but on a dark-skinned baby it may not be obvious on the skin, but the eyes are clearly suggestive when they are yellowish in color.
That might be very, very confusing. For example, in a day-old child, the skin of the color of the skin might be light, so it might be difficult for you to recognize or notice any change in the skin.
No, if the baby is light,
okay.
So when there's a yellowish hue, you will notice.
Okay.
But some babies are not light; they are dark. So you won't be able to see it on their skin, but you will definitely see it on their eyes, because the white of the eyes will be looking yellowish in color, especially when you view it in a daylight.
Okay. Now let's talk about the causes of neonatal jaundice. What are the causes of neonatal jaundice?
Okay. And either be physiological, meaning there is really no problem, or it can be pathological, meaning that there is a serious problem that we need to sort out. Because even in newborn babies who don't have any problems at all, because when they're in their mother's womb, the oxygen is not enough, and the body, in trying to compensate, makes a lot of cells that carry oxygen, meaning that their red blood cells are high. But when they come out to the outside world, when they are born, and there's a lot of oxygen, they cannot go on having that high red cell mass to carry their oxygen. So the cells are broken down, and when they are broken down, there is a yellow pigment which is called bilirubin that comes out from that breakdown. The liver converts it into a compound that is not poisonous, and it's excreted in the intestines, and they pass it out in the stool.
Okay.
Sometimes when the liver, because the liver in a newborn baby is not very mature, when it doesn't clear out this yellow pigment we call bilirubin fast, then it's now deposited in the eyes, in the skin, and we see it as jaundice.
Okay.
Then the pathological ones means that there is a problem which is either causing a lot of breakdown of these red blood cells, or interfering with the pathway by which the liver will excrete it or make it into a non-poisonous substance.
Okay.
We worry about jaundice as pediatricians because in the newborn, if this yellow pigment is not taken out, it can get into the brain. The particular part of the brain is the basal ganglia, and it can damage the brain, and that child may be brain damaged for life if the child survives the acute problem, meaning that the child can start having convulsions and may even die.
It makes it very, very worrisome and then a bit confusing, for a layman who is not a medical person, because ordinarily you think jaundice is nothing to worry about. But now that you have explained the pathological aspect of it, it makes it very, very important to know. And now, as a parent, how do you recognize, apart from noticing that the eyeball is a bit yellowish, what other signs are there for you to begin to worry or to guess that your baby has jaundice?
As I've said, the most important thing is what you've mentioned, the yellowness of the eyes. And that is why most times when babies are born, you will notice that people will tell you that the doctors want them to stay at least 48 hours before they go home. Because jaundice that appears within the first 24 hours of life means that it is dangerous. The what we call physiologic jaundice shouldn't appear within the first 24 hours. Usually will appear after 2 days, and the baby will not be sick, the baby will be sucking, the baby will not have any fever. But the one that is pathological means that the baby might be sick, and that brings me to the causes of this pathological jaundice. There are many causes, a long list, but let us pay more attention to the ones that are common in our environment. These ones are infections when there is bacteria in the bloodstream of the baby. Also, if the baby is born premature, born before 37 completed weeks, that's 9 months. Also, if there is an incompatibility between the blood group of the mother and the father, and the baby is carrying the father's blood group, the setting is that if the mother is O positive and then the baby is either A, B or AB blood group. Another one also is rhesus. We talk about rhesus incompatibility. If the mother is rhesus negative and the baby is rhesus positive, especially if the mother has had a previous rhesus positive baby in the first pregnancy, which has sensitized the mother and made her produce what we call antibodies that may attack the cells of her newborn baby. This will now lead to increased breaking down of these red blood cells I talked about before, and now production of this bilirubin, which is the dangerous pigment we don't want to be produced in excess in the child's body. Also, sometimes when there are some defects that affect the red blood cell membrane, the thing that covers the red blood cells in the body, if there are some things like the enzymes that are working there, if they're not working well, there's one we call glucose 6-phosphate deficiency. It's very common in our environment. There are some other ones that like spherocytosis, erythrocytosis, but what we call GCSPD, glucose 6-phosphate dehydrogenase deficiency, it's common in our environment. So it will make the red cell not to be strong enough, and the red cells would break down a lot faster than they should break down. Some of the times, I said diseases in the liver, that because the liver is supposed to convert this bilirubin, conjugate it, meaning that it makes it into something that is not dangerous, because conjugated bilirubin doesn't damage the brain. It's the unconjugated one that damages the brain. But if there's any problem with the liver as well, it can make this bilirubin that has been broken down not to be conjugated and not to be excreted out of the body.
All right then, doctor, that means that the health of the mother is so important while pregnant.
Yes.
So are there certain things the mother should do while pregnant to prevent jaundice in the baby?
Children. Yes, very good. The mother should register antenatally so that she's being taken care of by a doctor. I said that being born premature is a risk for developing severe jaundice. So because sometimes if the mother is not being taken care of, there are some things that may make the baby to come out earlier than usual. Also, if the mother gets infection during pregnancy and the infection spreads to the baby, infection is another thing.
It will automatically spread to the baby.
To the baby. And if the mother is being taken care of in a health facility, there are some tests they do while the mother is pregnant, and this will include the blood group of the mother. So if gynecologists find out that the mother is rhesus negative or the mother is O, they might find out that, okay, what's the husband's blood group, the father of the child? And if it's something that is going to predispose the baby, then we look out for it. So it means that when the baby is born, the doctor it's not such a mother that you discharge within the first 24 hours. You want to monitor the child to see the jaundice, and you give the mother clear instruction that anytime you're bathing for your baby in the morning, in the afternoon when you're looking at the baby, if you notice that the eyes are yellow, even if the baby has gone home, come back to the hospital. But if we notice the yellowness in the hospital, we do a blood test to determine the level of the bilirubin.
All right. Now, having known all of this, so how do you as a mother treat? For example, it is easy when you're in the hospital, how you're under observation, and then you're sure the doctor will guide you on what to do. But while the mother is at home and you notice this, are there some first aid measures you take as a mother before you go to the hospital?
No. Once the mother notices jaundice, she should bring the baby to the hospital, because the most important thing is to draw blood sample and find out the level of that bilirubin.
Okay.
When the level of that bilirubin is nothing to worry about, sometimes we might say go home and come back and recheck it another day. But if it's something to worry about, we might admit the child. If we see other signs, maybe the child is not sucking well, the child is having fever, the child is having some other problems, you admit the child, because remember I said that infection can cause it too. So if it's infection that is causing it, it means you have to treat the infection by giving the child antibiotics by the vein or something like that. Some other times we just put the baby under the lights, because phototherapy, the light has been shown to convert the bilirubin in the body to another compound that will damage the brain, and the body will just take out that compound.
Okay.
But sometimes there are some babies that even the light is not reducing the bilirubin, maybe because the breakdown is much, or the disease that has caused this jaundice is very severe.
Those are pathological ones.
Yes, pathological ones. They may actually need an exchange blood transfusion, because you want to take out the blood that has that bilirubin fast before it gets to the brain.
Now, my worry really is the fact that you said it's something that will damage the brain of the child. I want us to emphasize this, and then let's talk about some of the complications if not treated early enough.
Okay. Neonatal jaundice, if it's not treated well, can cause a serious problem in the baby, which is brain damage, because the bilirubin pigments can get into the brain and attach to the basal ganglia, and it can make the child to even die, or if the child survives it, the child will be brain damaged for life. And you can imagine a child that is already brain damaged for life. That is not pleasant at all. So it is important that the baby is taken to the hospital on time. And I want to also use this avenue to tell our mothers, our parents, we talked about physiological jaundice. So somebody's baby may have had the physiological type. So if they said, give the baby glucose water, give the baby pawpaw water, give the baby ampiclox, and they gave the baby nothing, the baby will be fine. It doesn't mean that it's those things that killed the jaundice. It's because the jaundice was a physiological one. But if a child now has pathological jaundice and you are advised to do those home remedies, in a case of pathological jaundice, most times by the time they bring the baby to the hospital, the baby is already brain damaged. So it is at the hospital that we determine that, is this jaundice pathological or is this physiological? Is this something we shouldn't worry about and just observe, or is this something we have to intervene for very fast to prevent brain damage in our children?
So in essence, doctor, self-medication is out of it, because you never can know which is pathological or physiological.
So it's better that is determined at the hospital
by the doctor.
Yes.
All right. Thank you very much for being a part of the show today. I'm going to see you some other time. Well, in case of just joining us, we're speaking with Dr. Oyenusi Elizabeth, who is a lecturer, College of Medicine, University of Lagos, and a consultant pediatrician, Lagos University Teaching Hospital. Thank you so much for being a part of the show. We'll have a break now, and we'll be right back after that. Please stay with us. It's still Children's Clinic. That was Dr. Elizabeth Oyenusi there, and we're rating so much about neonatal jaundice. And I'm sure now you know that it is very, very important also to immunize your child and breastfeed exclusively. Well, she has said you should breastfeed your child for 2 years. If you can, I'm sure it will take you out of trouble, if you know what I mean. We'll also package some information for you, which I know will be of help to you. And we'll also have a brief look at the health news segment. Stay tuned and be a part of the show.
Lassa fever kills 35, infects 76, says federal government. Nigeria has been battling Lassa fever outbreak in the past weeks in Bauchi, Nasarawa, Niger, Taraba, Kano, Rivers, Edo and Oyo states. Statistics from the Federal Ministry of Health indicates that in 2012 alone, Nigeria recorded over 1,944 cases with 207 deaths from Lassa fever. The government said measures have been put in place to curtail further spread and reduce mortality among those affected. Such measures include immediate release of adequate quantities of ribavirin, the specific antiviral drug for Lassa fever, to all the affected states for prompt and adequate treatment of cases. In addition to this, the government has deployed a rapid response team from the Federal Ministry of Health to all affected states to assist in investigating and verifying the cases and tracing of contacts. Lassa fever is a virus that has been killing Nigerians before the outbreak of Ebola virus disease, and experts say its symptoms is associated with bleeding and death in severe cases. Sugar may increase breast cancer risk. Researchers have found that the high level of sugar in Western diet could enhance the risk of breast cancer. The one that common sugar contained in soft drinks, cereal, ketchup, biscuits could be contributing to the high risk of breast cancer. Identifying risk factor for breast cancer is a public health priority. The researchers state that moderate sugar consumption is critical, given that the per capita consumption of sugar has surged over the years. An increase in consumption of sugar-sweetened beverage has been identified as a significant contributor to an epidemic of obesity, heart disease, and cancer worldwide. Eliminate mother-to-child HIV transmission, federal government task. The federal government has been tasked to live up to the expectations of Nigerians by meeting the goals of eliminating mother-to-child transmission of HIV, MTCT, in the country by the year 2030. According to UNICEF, Nigeria currently accounts for 55% of the new HIV infection in the West Central African region, WCAR, and with 3.4 million people living with the virus, Nigeria is regarded as a country with the second highest burden of HIV in the world after South Africa. Currently, an estimated 60,000 new HIV infections are recorded amongst children in the country, a situation that has called for aggressive mother-to-child transmission, MTCT, and prevention of mother-to-child transmission, PMTCT, intervention. What's the high prevalence of HIV among pregnant women, high total fertility rate, culture of prolonged breastfeeding, and non-use of modern health facilities for antenatal and delivery purposes, among others, contribute to the high rate of MTCT in the country. Better monitoring assistance for coverage and creation of strategic local funding initiatives were also recommended.
Alright, I'm sure the packet there was an eye-opener for you. Now you understand what neonatal jaundice is. I know now. I'm more educated, and of course I can advise people around me. But mind you, self-medication is very, very dangerous, and like the doctor said out there, do not self-medicate. The first thing to do, if the slightest observation of any of these ailments you've discovered, off to your doctor you go. Well, I hope you join me again next week for yet another edition of Children's Clinic. On the show today, we have talked about neonatal jaundice. I'm sure you have been tremendously informed. I have been. Join us next week. I'll be back to bring you yet another element as we'll be educating ourselves. And in case you have any observation you want to pass across to us, of course, please feel free to send that to the producer of Children's Clinic on MRTV. I'll be back again next week. Have a great day.